I'm Tony. I am a nursing student at FSCJ, second term, and I'm here to demonstrate the administration of a piggyback medication via already stabilized IV in a patient. So, first things first, we check the physician's orders and we look at the MAR to see what medications that we're actually going to bring to the patient. So, our patient today is going to be receiving vancomycin, 200 milligrams over 2 hours, and our tubing that we have here is set for 10 drops per milliliter. Available, we have vancomycin in a solution of 100 milligrams per milliliter. We will need a needle to remove that, and then we also have a 50 milliliter bag of normal saline in which to infuse the vancomycin. All right, vancomycin, as we looked up, is a antibiotic that binds to the cell walls of the disease-causing organism to cause cell death. Its purpose is used to treat potentially life-threatening disease infections that normal antibiotics are contraindicated for. A normal dose for an adult is 500 milligrams per 6 hours, so we're clearly within that range with the dosage we're giving today. Some side effects could include ototoxicity, hypotension, red man syndrome with rapid infusion, so we're going to try to stay away from that as well. Contraindications would be a patient that could be potentially hypersensitivity to it, or renal impairment, which we will look at our lab values that are given that were for this patient, and our creatinine levels were fine within normal limits. Our white blood cell counts are good. Some nursing implications that we will do while we're with this patient. We will assess vital signs. We will assess their vital signs. We'll assess for possible other infections. We'll monitor the IV site as well as their blood pressure. So, with all that said, we will get ready to administer this drug. As we said, we will need 2 milliliters of our product here. We will check the dates to make sure everything is fine. Dates are okay. All right. So we get ready to first, as with everything, wash our hands thoroughly. Try to keep everything as clean as possible. We will clean the vial here. We have new needles. Everything is clean. We will draw back 2 milliliters of air to insert into the vial as we withdraw the fluid. All right. Inserted, and now we will remove 2 milliliters. Making sure no air is in the vial. Alright. It's removed. So we will go straight to administering this into so I'll remove the plug here. Inject the fluid. Alright. I will scoop the lid here. And we will put that in the sharps container. Alright, next up we have the tubing here that we want to make sure we prime, so we remove the lid from it. We insert the plunger in here. Alright, so then we will get some fluid into the tube. Here the tube is locked, so we will open up the tube until we have drops, and we have drops. Alright, so we will close back the tube, so the tubing has been primed for the patient. We will label this bag with the patient's name, the drug added, the amount of the drug added, time, date, and the rate at which it's going to be infused. We'll also like to label the tubing, so therefore we can use the tubing multiple times if we have more infusions during the 24 hours which the tubing gets labeled. Alright, so next up, we remove everything. Everything is in place back in the appropriate areas. We will go over to the patient. See there, we had a piggyback earlier, but we will go through the steps as needed. Alright, so I'll come into the room. I will first start setting up for administration. Alright, so I should have greeted the patient first. I'm going to wash my hands. I'm going to introduce myself again. I'll get two identifiers from the patient, asking their name. How are you doing, Mr. Jones? Can you give me your full name and your date of birth? All right, both correctly checked. All right, I will look at the site of his already placed IV. Everything looks fine. I still see that there's a drop factor going on the regular IV, so therefore I'm just assuming that the line is patent. All right, today we're going to get some vancomycin in you. You know anything about that drug? Yeah, you've had it before. Well, it's a pretty potent antibiotic to treat the infection that you have, okay? So we're going to try to get this taken care of for you. Have you had any, is there any allergies that you might have that you might not have said before? No? No? Everything's on the paper? All right. All right, well, next up, I will have another alcohol swab prepped here, ready to go. The patient seems to have no problems with anything. All right, so I'll clean the port that I'm going to use. I have my new IV piggyback here. I will remove the alligator clip that is already on here. And then I will insert into the drug. Making sure all flow is stopped right now. I will then open up our piggyback to try to get the right flow rate that we want. We're going for our 4 drops a minute that we calculated earlier. Alright, that is set. And I'll open everything else back up for this patient. Alright, now I'm going to ask if there's anything else I can do for this patient right now. I'm going to check for pain, see if the site is irritated by the start of this infusion. Do you need to go to the restroom? Is your position okay? You want me to elevate the bed a little bit for you? Alright, do you need anything? You get anything closer for you? Get the remote, anything access? And also any pain, as I already said. No, you're good? Alright, so then this is going to run for about 2 hours, sir, and I'll be back to take care of it. Anything else? Alright, so then I will step away, leave the room. Tick-tock, tick-tock, 2 hours go by. Knock, knock. Mr. Jones, I'm back to see you. How you doing today? You good? Alright, it looks as though your medication's almost done here. Has it caused any pain? Any inflammation down here? No? Still good? Alright. Wash my hands again. I washed them as I entered the room, but I'll wash them again to start messing with the... Alright, well first off, I'm going to disconnect this for you. Alright, sound good? Alright, so I close off this. I have brought in clean alligator clips with me. I will remove this and insert the alligator clip to hang so that future administration can occur without having new tubing if it's done within the day. I will reassess the drop rate on the initial one to make sure it's back to what was ordered. I will leave that right now because we still might have a potential piggyback later. Make sure everything's good. Ask the patient if they need anything else again. Use the restroom. I know you're putting some fluids in you. You might have to use the restroom. No, you're good? Any more personal belongings? Can I get you need a drink or anything? Or everything's good? So no pain, you said? Your position's good? You don't have to potty? I got your personal belongings? Alright, well, sounds good. Alright, well, I'll be back to check on you in a little while. If you got any other questions, you know how the call button works, but if not, we'll be in here soon. And then I will remove any potential trash, things like that, and leave. And then when I leave the patient's room, I make sure I document everything that I've done for the patient. I document the medication that I gave, the time, the date, the dose, the route, the site, in case the site was irritated, things like that. I need to make sure I keep a documentation of that. And then I will be ready to administer the next dose if needed.